Hi guys, this is Preeti and you're watching my dissolution. In this video, I'll be teaching another important question from the university point of view, that is testis, which is a long answer question. It is a male gonad. It is present on either side in the scrotum, so it is a bilateral organ. It is homologous to ovaries in the female, and it is a mobile organ. It can ascend or descend to maintain temperature of the testis, which is required for the spermatogenesis, and its function is production of sperms and secretion of testosterone hormone, which is required for the to maintain the secondary sexual characters in female. The shape of these testis is oval or ellipsoid shape, and dimensions will be, the length will be 5 centimeter and the breadth is 2.5 centimeter, and the anterior posterior length is 3 centimeter. Position it is present in the scrotum. It is suspended by the spermatic cord, which is attached on the upper pole. Upper pole is tilted laterally and forward. Upper pole is tilted. Lower pole is tilted medially and backward. And external features will be, it has two poles. You can see in this image it has two poles, upper pole and lower pole, two borders, anterior border and posterior border. It has two surface, lateral surface, medial surface is not visible where this epididymis is attached. So it has two poles, upper pole and lower pole, two borders, anterior and posterior border, medial and lateral surfaces. Medial and lateral surfaces smooth and convex, and these two poles are convex and convex and smooth. Upper pole where spermatic cord is attached is known as upper cord, and anterior border is round, and it is completely covered by tunica vaginalis. So as you can see in this image, this is completely covered by tunica vaginalis. This is the anterior border. It is completely covered by tunica vaginalis. Whereas posterior cover, it is not completely covered by the tunica vaginalis layer. This is the tunica vaginalis layer, where inside this the fluid is filled. This is known as hydrocele. This condition is known as hydrocele. The upper pole and lower pole are smooth and convex, and upper pole where the spermatic cord comes and attaches, anterior border is round and completely covered by tunica vaginalis, whereas posterior border is tight and slightly covered by tunica vaginalis. The coverings of testis are, there are three coverings of the testis, that is tunica vaginalis, tunica albuginea and tunica vasculosa. As the vasculosa name says, it is a vascular layer. It is the innermost layer. Tunica vaginalis is the outermost layer, which is a persistent remnant of process vaginalis is a tunica vaginalis. Tunica vaginalis has further two layers, visceral tunica vaginalis and parietal tunica vaginalis, and tunica albuginea, which is a thick and dense tissue, fibrous tissue, which is in contact with the epididymis, direct contact with the epididymis. This is a tunica albuginea, and tunica vasculosa, which is the innermost layer, and this is the vascular layer. The collection, the few clinical important points are the collection of blood in tunica vaginalis, parietal tunica vaginalis and visceral tunica vaginalis. In between those two, we have a space. Their collection of blood is called as hematocele, collection of pus is called pyocele, and collection of any fluid is called hydrocele. And arterial supply for testis will be left and right testicular artery and left and right testicular vein from abdominal aorta at L2 level. Two gonadal arteries will come out in males. In case of males, those are testicular artery, left and right testicular artery, and as it passes into the deep inguinal ring, and then it passes through the inguinal canal and then comes out through the superficial inguinal ring and divides into many branches. Out of those, two larger branches, there are so many smaller branches, and two larger branches are medial and lateral testicular branch, and this is testis, supplying testis. And so abdominal aorta at L2 level, it divides into right and left gonadal arteries, which in males these are right and left testicular artery. And venous drainage of the testis. Testis is drained by the Pampliform plexus. From Pampliform plexus, as soon as it crosses superficial inguinal ring, it forms a four larger veins. After it crosses through the inguinal canal, and then after it passing the deep inguinal ring, it forms two separate veins, and then it drains into the left testicular vein, which is joining the left renal vein. Left renal vein further joins the inferior vena cava. Whereas in the right side, pampiniform plexus drains into the four major veins. From there it drains into two separate veins after crossing the deep inguinal ring. There it is drained into right testicular vein, which is in direct contact with which is directly drains into the inferior vena cava. This is a venous drainage of testes, and you have to learn about the lymphatic drainage, which is separately important for a 3-mark question. The lymphatics from the testis is drained into the pre and para-aortic lymph nodes. Pre means before, like it is placed front of the abdominal aorta, so pre-aortic lymph nodes, and para-aortic they are placed sideways to the abdominal aorta, so they are para-aortic lymph nodes. Testis lymphatics from the testis is drained into pre and para-aortic lymph nodes at the level of L2. And the external features of testis can be depicted in this video, in this image. That is, this is upper pole, this is a lower pole. This is anterior border, this is a posterior border where we find the sinus of epididymis. On top of this, there will be epididymis, head, body and tail of epididymis. This is ductus differentiate, where epididymis further continues as ductus differentiate. And this is a lateral surface, medial surface, which is not seen in this 2D image. If you find these videos are helpful, please do like, share and subscribe to my channel. Thank you.